years ago, when I decided to take on leadership, I had to make a speech as the secretary. And my speech was about the coming healthcare reform. At that time, the act had either just been passed or was still being debated. And my speech was about healthcare reform being this empty canvas that we didn't know what it was going to look like. And here I find myself 3 years later, and we still don't know what healthcare reform is going to look like. But I think there are some key concepts that we now understand are going to be part of that healthcare reform. And I think there are things that we either need to be involved with now or being involved with fairly quickly. The first one that I want to talk about is PCMH, Patient-Centered Medical Home. Now when I say that, most people in this room have a gut instinct that says, I am a PCMH. I am a patient-centered medical home. And that is a credit to family medicine that we have always felt like we were the patient advocate. But to be a PCMH, it's got to be more than a mission statement. It is a design and a creativity of your office that you are going to present best practice care to all of your patients all of the time. And you can't do that if you're not doing patient registries and population management and QA studies where you're looking at quality indicators and then doing the PDSA studies to prove that you are doing quality. When we get to where we need to be, we'll need to measure patient outcomes. But we can't measure outcomes if we're not measuring the little steps that we need to take to get there. The next thing I want to talk about is EHR and HIE, Electronic Health Records and Health Information Exchange. There was an article in a recent Salina journal, and it was about a practicing physician who's 85 years old. He doesn't have a fax machine in his office, nor a computer. He dictates his clinic notes to someone who writes them out longhand on a legal pad. This article was talking about how the effects of the ongoing regulations and recommendations for electronic connectedness and how it's going to affect doctors practicing in the state. While I admire this man that he is still doing the practice of medicine, I was a little sad to think that such a practice still exists in this day and age. This is the electronic age, like it or not. There are multiple people in this room that have never known a rotary dial phone. They've never had a kitchen without a microwave. They don't know that TVs once required antennas for reception. Those people are probably texting in this room even as I speak. To be electronically connected is a requirement in the modern business world. Can you imagine a banking industry that was not electronic? Healthcare is long overdue to take this big step. One of the most archaic things in the world right now, in my view, is a handwritten script that nobody can read. The next thing I want to talk about is ACOs, and this is probably the piece that I find the fuzziest. The KAFP is committed over this next year to try and get more information and more education out to our membership about where ACOs are going to fit in. To have successful healthcare reform, we have to have every piece of that puzzle together at the same table. We have to be committed to providing evidence-based, quality, measurable outcomes for our patients with cost efficiency. Everyone at that table has to be motivated for this one goal. And if we're motivated, we'll take on sharing the risk, and we'll take on sharing the savings. Now, it is going to change this widget payment system that we live under right now. But you know, the payers are on board. We just have participated in the PCMH pilot project, and Blue Cross Blue Shield was there paying the PCMH pilots more money to be a PCMH. Blue Cross Blue Shield is at the table right now with KHC, the Kansas Healthcare Collaborative, coming up with payment strategies to recognize quality indicators in offices across the state, no matter what the specialty. It is coming. We don't know what it is going to look like. But I guarantee you that when Bill Gates presented his PC with a DOS operating system, and I guarantee you a lot of people in this room are going to say, DOS, what is that? When he came out with that, he had no idea that we would have smartphones today. And we have no idea where smartphones are even going to go. I do know that the Kansas Academy of Family Physicians is going to keep family medicine on the forefront of any changes that are coming. And we're going to reach our members by education, by communication, by continuing our legislative advocacy that we've already done. And we are going to be there when the change happens. I am more convinced than ever that family medicine will be the foundation of any successful healthcare reform. I am excited to be there with all of you, and I look forward to seeing you next year so we can see how far we've come. I invite you to enjoy the rest of the meeting. I want to see you guys next year. I want you to bring colleagues, and let's see how far we get this year. Thank you very much.